All right, am I live? Is this? Oh no. No. How do I see myself? It's all right. I'm trying to do this so that I can see your comments. And here we go. Okay, I can see. Sorry, let me put on comments just so I can. Well, hopefully, I can figure this out here real quick. Well, I apologize. This is a technical thing that I cannot figure out. So, what I'm going to do is I'm going to actually jump on my phone so that I can watch and try to read comments here right now. Okay. So, I should be live. It's been here I go. Okay, I can see. All right, I got one person watching. So I'm going to give this a minute. If you're watching, go ahead and comment here, just so I know that you're there. My phone's going to be right here just so I can see comments as they come through. Looks like I got 2 people watching. Thank you for joining. And can you all hear me? Just comment if you can hear me. Thank you for, accommodating the change with the schedule and everything. I know that it was kind of last minute, but I just decided from the energy and from the messages I was getting that it'd be better to do this virtually rather than in person. So I'm going to wait a minute, give people an opportunity to jump on. And hello, hi Regina, hi Amy. All right, looks like people are on. There is definitely a few second delay between when you message and when I will see it or hear it. So it sounds like Amy says, sounds like you can hear me. Okay, so good. All right, so we got a couple people watching. I'm excited to be here with you. One of the, if this was in person, one of the first questions I would ask is what's your interest in hearing about this topic? What drew you to this topic? What made you want to attend or listen to this? So go ahead and just comment. Let me know what you are here for. It helps me understand who I'm talking to. I get everything from teachers to sometimes I'll get a Parker student here or there, which is a chiropractic student, but most are parents, right? And there's all sorts of reasons. Kids with ADHD, autism, behavioral issues, academic issues, and so I always like to hear why you're interested in attending this. And so go ahead and comment whenever you get the chance. But I'm excited to jump on this with you and talk. This is something I'm passionate about, and I've been known occasionally to be a little long-winded about just because I love talking about it. So I'm excited to be here. I love in person though because there's energy involved with that, right? I can see your face. There's comments, there's questions. And so, it was a tough decision to go virtual again, but I think it's probably in the best interest. So, I get a lot of questions typically during a talk, right? Like there's just, my kiddo has this going on, or, what do you think of this? And a lot of those are great questions, and I love answering them. But if they're very specific questions, meaning, like my kid has this, or I've seen this in my kid, what does this mean, right? And those are difficult questions to answer without enough information, right? And so I've tried in the past to answer the questions, but I found myself struggling to answer them because I just don't have enough information. So at the end, I will give you the opportunity to speak with me privately if you like. I'm happy to answer questions. It looks like I have a teacher on, awesome. A daughter with autism. So look, I want to answer your questions. I love answering your questions and helping you. But if you have a very specific question, let's just wait to the end and I can answer them on a one-on-one basis. If you have a very generic question, like, I don't know if it's generic enough where I feel like I could answer it, and I will. Happy to do that for you. Also, what was I going to say? I'm going to speak in not generic. I'm going to speak generically in the sense that I'm going to talk about commonalities that I see with kids. And so sometimes I'll say something, and a parent will be like, "Well, okay, but that's not the I see all the stuff you're talking about, but my kid's not like that, or my kid didn't go through this." And one of the important things we need to understand is every kid is different. Every kid has gone through different developmental stresses and all sorts of other things, and so so there's occasionally where I'll say something and it's meant to be broad, okay? It does not always pertain to every kid, and so in this office I treat every kid as an individual, not as a 80% of kids have this sort of deal. But during this talk, I'm going to speak more in generalities, but just realize that it may not, not all of it may apply to your kiddo. And so, all right, I'm excited. We got 3 people on. Thank you for commenting. I really appreciate it. ADHD, autism. Okay, all right. So those are things that I'm definitely going to touch on. All right, okay. All right, so a little bit about me. I am passionate about this topic. I was a kid when I was, up until the age of 5, I had severe asthma attacks. I was on albuterol, inhalers, and actually I remember this vividly as best as you can as a 5-year-old, right? My mom was going to a chiropractor, and the chiropractor ended up adjusting my mid back at the age of 5, and I remember this sense of like relief, and it just kind of like this, and it ends up that after that, maybe a couple of adjustments after that, but I remember that one specific adjustment. I didn't have a severe asthma attack after that, meaning I don't know that I ever used my inhaler after the age of 5. And prior to the age of 5 and below, I had been to the hospital multiple times for severe asthma attacks. Spent a couple nights, in an oxygen tent, and as a 3-4-year-old, I was just talking to my mom about this recently. There's just a lot of fear with that, right? Like you can't breathe, and I do remember that, not being able to breathe. It's kind of a terrifying experience. But you can't breathe, and you're in a hospital, and you don't know what's going on, and that stuck with me. But when I was going through chiropractic college, I had no interest in treating kids until I started seeing some of this cool stuff that we've helped with. But that wasn't my main focus. And then it wasn't until I had my kiddos, and you can see them there. That's my son Chet, who's about to turn 4, and my daughter Tinsley, who's 2.5. And not until I had them where I was like, I just got obsessed with this, and to the point where this is my focus, and this is what I love talking on, and this is what I love dealing with. This year alone, I will do 175 continuing education hours for neurodevelopmental stuff. I will be focus certified, so I'll be the first clinic in Dallas to be focus certified, and that'll be coming in October. And as long as the dates are not conflicting, which I don't think they are, I will also be sitting for my test for a fellowship in neurodevelopmental disorders. So, look, I love this stuff. And I love this stuff because I think there's so much that we can do to help these kiddos that doesn't involve drugs or medications, and really you can change lives. Look, we see adults too, right? So I love, helping a dad with low back pain. That's pretty cool because he can go play basketball with his kids or do whatever. But when you take a kiddo who's struggling and you change their life so that the trajectory of their life is different, where they're not, tied to a medication, or, they just function, they make friends, and they do all, you've changed a life, and that's exciting for me. So, you'll see here on the bottom it says salutogenesis. This is not something this is not a word you probably commonly hear. It's essentially kind of the opposite of pathogenesis. So pathogenesis is the idea that we are looking for something to create we're looking for something that's a pathology, right? I take an MRI, I find, something in the brain, right? Or an x-ray, or we do blood work, all that stuff. Salutogenesis is the idea that, like, how can we improve the function of the individual? Like, where are there ways that we can improve their health, right? And so the best example of that I think is exercise, right? Like, when people exercise, they are healthy, right? Exercise helps with lots of things. It's helped with cholesterol and blood sugar and sleep and digestion. It does all these things to function better. And so our office thrives on how can we improve the function of the person, right? So how can we help? My wife sees her specialty is, or what she focuses on is preconception, pregnancy, and infants, and so she deals with all that, and I deal with all the dads and the kiddos. All right. So speaking of salutogenesis, I'm not going to tell this little one's testimony because I want to talk about another kiddo's. So this little guy last year he started school, and a really just cool little guy. But dad sees that I'm going to have a workshop. This was last August, I think it was, and on the same thing. And he reads that chiropractic doesn't treat or cure autism. Okay, I know what article he was talking about. I read it the same day before, and so he's interested. He wants to see what I have to say. So he comes in, and his son that he came in for was just diagnosed on spectrum, and had what they reported some social behavioral issues, so didn't play well with others, had some delayed speech, and made poor eye contact. Those were the three things. And so he got this diagnosis. He was on spectrum, right? And so this kiddo comes in. I give the talk. Dad's like, all right, let's do an exam. So I do an exam, and I look at the physiology and the function of the kiddo, and I'm like, okay, well, we definitely have some things going on here. And so I started working with the kiddo. And so I think I started in end of August, if I remember correctly. And December, they have some sort of statewide test. I didn't grow up here, but I think it was the STAR test that they had. And so prior to starting care, he was, he was behind his peers academically. I think everything except for math. And then, so he comes in, and his dad's like, he blew it out of the water. He did phenomenal. He scored very high in all of the, ironically, everything but math. Because his dad's like, I think he's really bored with this math. But this kiddo, and I don't mean this in any, please don't misinterpret this as being mean, but we had a kiddo who didn't make eye contact and who had poor verbal skills. And by, come December, January, I just couldn't get the kid to be quiet, right? He just would not shut up. And he's such an awesome little kid, and it was so cool to see that. But a lot of times, when we think of autism and some of these other things, we think there's like this hard, like we're looking for a pathology, right? And a lot of these kids are stuck in this gray area where the functionality, right, is not good, and it is not functioning the way it should. And so you'll have these kiddos who are on, like they may be a little bit behind in speech, and the way they process their environment's a little bit different, and they're given a diagnosis. And these are the kids I love working with. And so that one, his story came to mind when I was thinking about this, because it wasn't a kid where you're like, that kid, if maybe his uncle, at a Christmas party, you would say that kid definitely is on spectrum, right? Maybe he's a little shy, maybe he's a little, whatever. You think, I don't know what's going on there, but maybe there's something going on there. This kid it was just so cool to see him thrive, and just to see everything that he was able to do in January and December. All right, let's move on. All right, these are some great books. These are just some of the books. In the upper left-hand corner, Disconnected Kids. Have any of you read that book? It's by Dr. Robert Melillo. I always struggle to say his name. He has put out a couple books, Disconnected Kids, Reconnected Kids. Both are great books. If you haven't read Disconnected Kids, you can find it on Amazon. It's a great book. And I agree with a lot of the stuff that he says. He gets really big into right brain, left brain stuff, and there's definitely some truth to that, but I don't see it completely as he just sees it right and left brain. But he has all sorts of great information in there, and it's a book for parents, and so that's a great book. I always suggest that one. Also, it's a dense book. It's almost like a textbook sometimes, I think. The Brain That Changes Itself on the upper right-hand side. That also is a good book. But I'll just tell you this is the summation of that book. It's the idea that the brain is not like set in stone and that the brain can change if we alter the things that we do. Meaning that if we change the stresses in our life, the physical, chemical, emotional stresses, we can change the way the brain is functioning. And so it's cool in that aspect because, when I was in undergrad, which would have been early 2000s, I remember them saying like the brain is stuck, right? Like, you grow up and it doesn't change or alter, but now the research is showing that it does. And they did a recent study of, I think it was mid 40-year-old women who did Tai Chi and yoga, and they showed that their brain plasticity, so their ability to change and adapt and all this stuff, was the same as a 25-year-old. So look, we're talking about some of the most cutting edge sort of stuff here in brain development, and the idea that we are not stuck in a pattern anymore is so awesome, because this is really going to change the way that we can help these kiddos. Hey, Amy, we can discuss that. All right, so what's going on, why, and what's next? Let's discuss all that stuff. All right, so autism. Look, this is, what is it, 1 in 50? This is an old slide, okay? I've heard upwards of 1 in 25 now. Back in 1970, it was 1 in 10,000. And so, part of the argument would be, hey, we're better at diagnosing this. We're more aware of it than we were in 1970. Although we were aware of it before this, because there was doctors in the 1890s that were finding kiddos with autism. They didn't give it that name, but they were seeing the signs of autism. And so, I mean, it was there. We are better at diagnosing it, but what they're saying is that we cannot explain 50% of the diagnosis increase because we're better diagnosing, because we're better at diagnosing this stuff. There's nothing, we are good at it now, but 50% of the diagnosis has nothing to do with it. So what we're seeing here is a true epidemic. And we're seeing this at just a crazy rate, right? Like 1 in 15, 1 in 25, it's getting out of hand. And I know we have, with the virus going around, the COVID virus, there's a lot of fear and worry and all that stuff. But look, we already have an epidemic here. Kiddos are being diagnosed with autism at just a scary rate, and that's just autism, right? And so, in 2014, it was 1 in 50. Now they're saying it's about 1 in 25. We're going to get to the point, I think, where we're going to see 1 in 10. Maybe if this keeps on the same track, 1 in 5, right? And so it's an interesting road that we're on, and we need to start addressing this stuff now. All right. 11% of kids in 2011 had ADHD. So 1 in 10, essentially. That's 6.4 million kids. I was just reading a study that was talking about the overall costs, and so the overall cost for ADHD, just ADHD, for a parent every year in medications, $1,000 more per kid with ADHD, and I think the additional cost that had nothing to do with medication or anything was an additional $1,250 is what they averaged. So a kiddo with ADHD, for medications and other things, the average cost for that kiddo extra per year is over $2,000. And they went on to say that, I forget how many billions of dollars it costs the United States annually. It was astronaut, it was like $50 billion or something like that. But they were also saying when these kids reach adulthood, the average income loss due to ADHD was around $400,000 to $600,000 over a lifetime. I mean, that's a massive impact to a life, right? I mean, like, you could have made $600,000 more. I mean, that's retirement money, all sorts of things. And so the quality of life of these kiddos is being impacted. Their families are being impacted, and their ultimate quality of life is being impacted. OCD. now affects 2 to 3% of kiddos, which is over 2 million. I've heard 5 to 7% of kiddos have OCD, and more recent studies show that. So, that I don't even know what, I haven't read a study recently on the impact of that, what it could do academically. And what we're seeing too is a lot of these kids with ADHD, autism, they have other comorbidities, right? So not only do they have ADHD, they have OCD or ODD, or we have autism and ADHD, or autism and ADD. And so a lot of times these kiddos are having many diagnoses all at the same time. And so a lot of times they're on different medications for different symptoms or different diagnoses. And so this, you could easily see where $1,000 can be spent on medication and other therapies and other stuff. And so the impact on the families' lives and on the kids' lives is astronomical. All right, anxiety. 1 in 8 kids. When I saw the stat, it was mind-boggling that 1 in 8 kids suffer with anxiety. And I started thinking back, and I was like, that's true. I would say probably in our office, at least 1 out of 10, but I would say it's probably more 1 out of 7 kids that I see have anxiety, is what the parent puts down. Or when you keep digging and you're talking to the parent, I'd say probably it's more close to 1 in 5 that I see that come in, and the parent doesn't maybe mention it, but as I dig, they're like, they have anxiety. And to think, these kids that are, a lot of times they're coming in at 5, 6, 7, 8 years old. They're young and they have anxiety. It's just sad because they're struggling. They're struggling academically. They're struggling socially. And no 4, 5, 6, 7-year-old should have anxiety. And so, they're being put on medications for this. I've heard medications as young as 4 years old for anxiety. It's just astronomical. We're not even talking we're just talking anxiety, which can lead to depression. So, there's tons of other, comorbidities that go with anxiety. And so it's just sad, and we need to start changing these numbers, because as a society, as a culture, this should not be acceptable. But two, just the cost to the families and to these kids is just so high. We need to start correcting this stuff. All right, this was the stat actually now is 49%, so basically 50%, right? Have at least one chronic health condition. So, whether that be, diabetes, whether that be, because type 1 diabetes, whether that be, it's just crazy some of the stuff that, comes up with these kids with chronic health issues. 1 in 20, 30, let's just take this stat, 32 million kids have a chronic issue. So, we're seeing an epidemic of chronicity, of all this stuff. It's impacting our kids. All right, I have a couple people watching. So, I'll just ask: have any of you heard of the Canary in the coal mine? I always get mixed answers for this. I always hear different answers. I swear I'll have a talk and no one's heard of it, and then I'll have a talk and everybody's heard of it. So just interested, has anybody heard, or have you ever heard of the Canary in the coal mine? I liked this comic because it hit home. It just hit home. And I'll tell you why. So the Canary in the coal mine. So back in the day, before miners, somebody who's mining, had an alarm system like they do now, the technology they do now, what they used to alert them to air quality, to what was going on in the environment was a canary. Because canaries are more susceptible to environmental stress and harms. And so when a canary died, it meant that the environment is dangerous. So if you were a miner, 100 years ago, and the canary that you brought with you died, you got out of the mine, because I mean, it was your life. And so, look, in the comic, the canary has died, right? And the guy's like, oh, that's normal. And unfortunately, that's what I'm hearing from parents is they're going and they're seeing something, right? They're seeing something is going on, right? And they're making this observation like, hey, you know what? I'm seeing all this stuff with my kiddo, but is this normal? Is this common? What's going on? And so what they're being told is that this is very common. Yeah, he or she will grow out of it, right? And so the parents are seeing the canary. The parents are seeing like the signs, the symptoms that something is going on developmentally, okay? And they're being told they'll grow out of it, that it's normal, that it's common, that we see it all the time. Let me tell you this, from a developmental aspect, kids do not grow out of something. They grow into something else. And so, we have these parents that are observing these things, and they're kind of being, brushed off as in like, this is common. We see this all the time. I'm telling you, parents, that look, go with your gut, because I would say a vast majority of the time, the parents are right in this scenario. They saw something, they were observing something, they brought it up, and they were ignored. And so, look, common does not equal normal. Next slide. Here we go. All right. All right, so this is a Audi, right? A beautiful car. I don't own an Audi, but I know that Audis are very nice, expensive cars, and the way that an Audi like this looks like a Q7 may work is, hey, it's got parts, right? We know it got engine, steering wheel, tires, all that good stuff. That's good to have parts, right? And that makes it look nice, and it could possibly work, right? But then we got power, right? So we got fuel. Okay, and all those things are good. But information. So this is the crux. This is the key. That's why it's spaced out from parts and power. Look, our kiddos have parts and power. All right, brain, heart, liver, kidneys, all that fun stuff, right? And they have power. They eat food, right? Okay, so they have the parts and the power. The problem with our kiddos is their ability to process, interpret information, right? And so, you need information like how to drive the car, how to use a blinker, how to clean the windows. But you also need to understand what's going on in your environment, right? Like this Audi is no good if you can't see through the windows, right? If you had, those glasses on that block all the light out. Like you need information. The car needs information. And these cars are so amazing now. They can tell you the front right tire is low. You have, we have a Highlander. It tells you got 11 miles until you need to fill up your tank. And what's interesting? So my sister, right? So she has this. She got a Highlander or something like that. But I saw her one time, and her gas gauge did not work. Like, does not work. So. All she does is go, between work and then home and work, real common stuff. So she kind of based her information of how far she could get in her car based off of a 5-day work week of her just going to work and coming back home. So at the end of the week, she filled up her gas tank. That's, in my mind, I'm like, that's the least efficient, safe way to do it, right? Like, I would pull up my owner's manual. Okay, like I got a 10-gallon tank, right? And try to figure it out. Like, I just filled in 5, I just did a trip of 50 miles, right? And I've put in 5 gallons, so I get 10 miles per gallon. So, I can drive 100 miles, but my sister just guessed it. So, look, information is important. And the problem with our kiddos is the way that they are receiving and interpreting information. And this starts with conception, pregnancy, birth, but all of that impacts how these kids process it. And unfortunately, these kiddos have an immense difficulty processing their environment, internally and externally. Most people think that there's 5 senses, right? Eyesight, ears, or hearing, touch, all that fun stuff. But there's really 8 senses. And combined, those 8 senses tell us what's going on internally and externally. And so you can imagine, if you were to suddenly lose your sight, the way that you navigate the world would be different, okay? But let's pretend you don't lose your sight. Let's pretend you lose some of your sight, right? But glasses haven't been invented. That alters the way you perceive your world, right? You become more dependent upon hearing and touch, right? Well, these kiddos, because of altered development, have altered sensory input, so they become more dependent or have less control and regulation over some of the way that their body interprets and their environment internally and externally. And so in the end, a living organism is very similar to a mechanical system, right? It has parts, it has power, but the information is key. All right, I'm going to skip this slide. Well, not this one. What do living systems need? Parts, power, and information. I'm telling you right now that the information, the way that we receive, interpret, and process information is the key to helping a lot of these kiddos. All right. So this is the slide I was going to skip. But a living organism, a plant, right? So when I was in undergrad school, I was part of a research study. Okay, so I helped one of the professors there, and I made a bunch of material for a plant that we were studying called the Arabidopsis plant, and we altered one of the genes, and we put different sodium, potassium, calcium levels, and we put the plants, had them grow under different gravitational stressors, and the environment mattered for the trajectory of the plant, meaning the gene was important, right? But what ultimately impacted a lot of the growth in the function of the plant was the environment. Like how much sodium or potassium and calcium do we put in there? And ultimately, what stress of gravity do we put in there? And we saw all this different stuff going on. And so, look, in the end, the parts mattered, right? But it was the stress that was on the parts. And when we have a lot of stress, parts break down. All right, I'm going to skip the next one. Any kind of initial questions? I know there's a couple people watching. If you have a question, I'm going to take a quick pause here just to see if you have any questions. There's definitely a few second delay. And so this is the part of the talk where we're going to talk about what's called epigenetics, okay? And epigenetics are really, it's the study of how does the environment impact genetics. Because in the end, these are developmental issues, right? These aren't genetic issues, these are developmental issues. And we still have lots of money going towards genetics. They're trying to find the gene, right? Or maybe a set of genes. And they'll find some commonality with genes, right? But they're never going to find a magic gene that, if this gene is off or on, then we have autism or we have ADHD, because that's not how the system works. We have this beautiful system where our genetic material is essentially influenced by our parental stressors, right? So the stress of the parents, whatever the stress may be, right, impacts our genetics. And so in doing so, our genes are turned on or turned off in preparation for what we're expecting out in the environment. And so it's kind of cool in that way. But when we have so many stressors now, because look, our water's polluted, right? Not just from what we put in it, but our drinking water with medications, they're finding that. We're drinking out of plastic, which has, different pollutants in it. Our air pollution, right? Living in Dallas, there's a lot of air pollution, and there's a correlation to that and neurodevelopmental stuff. So we've got our air is being polluted, our water is being polluted, our food, processed food. And so we're living in a more toxic environment than we were in 1970 or before, right? And so that's the other 50%, right? So when I was talking about, the 50% of our diagnosis not being related to just being better at diagnosing, the other 50% is just our environment and the things that we change, right? Like, our parents my generation, we are not as active as we were in the 1970s, 50s, 60s, whatever. And a lot of the jobs now are at a desk, right? We don't use our body as much, so it impacts our genetics. And the same goes for our foods. It's more processed, less nutrition in our environment. It's crazy. And so, they're saying now that sitting is the new smoking. And so we are seeing this, and this is just going back to the canary in the coal mines. This is coming back to the stresses of the past generations are impacting our kids now. And I'm going to say this to dads, any dads that watch this. Look, it is not mom's fault. You're half the genetic material. And so, dads, it's very important that we take care of ourselves too. And so, we need to exercise. We need to clean up our diets. We need to, whatever, stop drinking Monsters or Cokes or whatever we're doing, because look, that stress, the toxicity that we're putting in our bodies and adding to our bodies ultimately impacts our kiddos. And, if you're honest with ourselves, right, we would explain dad's poor health to the rise in boys, or that's why boys have more ADHD, autism diagnosis, right? Because it takes half a material, right? In females, they have 2 X chromosomes, right? They come together, and so they have a balance. If mom's fairly healthy, she can make up for genetic anomalies. But with a boy, it's an X and a Y, and you don't have that benefit of mom being healthy. And so dad's health really plays an impact in our kids' health. And so, look, Dad, it is up to us. It is partially up to us because we are 50% of that genetic material. We are important in the placenta and the cord, and so it is so vital that we, as parents, dads, take a role, especially if we're going to have more kids, in making sure that they're healthy. All right. Quadrangle, the neurodevelopmental quadrangle. So, look, you'll see the nervous system at the very top center. That is the crux of this all. Our brain and our nervous system, it receives information in and sends out commands. So it is constantly receiving environmental, internal information, and it's making commands. So it's telling the body what to do. And it's impacting our immune system. It's impacting our detoxification system. And it's ultimately impacting our GI system. And GI systems are one of the most common issues that we see in kiddos with neurodevelopmental stuff. And so, look, I'll actually do it in the next slide. But look, we have these environmental stresses, right? Maybe it's from the parents, or maybe it's just the kid being born, and then look, they're just not eating well, right? And so it's ultimately impacting the brain. It's impacting information to the brain, and it's impacting how the brain is responding to the environment. And that's when we're seeing all this stuff. And so we're seeing these GI issues. We're seeing these detoxification issues, right? Which is ultimately related to GI system. We're seeing this MTFR stuff, right? We're seeing this poor immune system, or we're seeing this hyperimmune system. I mean, you have both ends of the spectrum there, right? I got kids that come in with developmental issues and they don't ever get sick. And then I have, a very similar kid and they're always sick, right? And so look, it's how are the brain and the immune system working together? What's the neural inflammation? How is this all coming together? And until we can understand this all and put it all together, we're going to continue to see this rise. But it all starts with the brain, because in the end, the brain controls everything. And I would say probably one of the most common things that I see, and one of the most common frustrations that I see, are parents working on the GI system before they work on the brain. Look, the brain controls the GI system. The brain gets information from the GI system, but the brain controls the GI system. And so, I'll get a parent comes in that's like, look, we tried some stuff, and my neighbor, Susan changed, the kid, the little boy Tom's diet, and you know, he doesn't have ADHD anymore. Yes, that's going to work with some kids. Maybe he was deficient in something. But for the most part, our developmental kiddos have a brain developmental issue that's impacting the GI system. And so you get these parents who are like, I tried the dietary stuff, I tried it, and it didn't work. And they're wondering why, like, why did it work for my neighbor's kid and why doesn't it work for me? Well, look, until you address the brain issue, the GI is always going to be an issue. Always. And that's why most kids with autism, vast majority of them, have GI issues, right? And so we have to start with the brain. The development of the brain is the key, the crux, the linchpin to working this quadrangle. All right. Trifecta. I'm going to get to all of, I'm going to fill out this whole, okay, all right, here we go. So, look, genetic or environmental induced predisposition. That's just epigenetics, okay? So they did a study out of Holland during, there was a famine there during World War II, and it depended on when it impacted them during conception, whether it was in the first half of the pregnancy or the second half of the pregnancy. But depending on where it was, ultimately impacted the health of the kiddo. Whether or not, so what they found was that, I'm trying to think here, it was, I always get it backwards in my head. I think it was the first, if the famine happened during the first half of the pregnancy, the kiddo was born very skinny, but ultimately ended up being overweight, and most of them died prematurely from heart disease and cancer, versus the third trimester where they had normal weight and they didn't grow as heavy. So look, I mean, stress during development impacts ultimately how the genes are activated and what's going on. But the environment is playing a huge role. And look at all of these things that impact the microbiome. So C-sections, they're finally working on this. There are hospitals now that are swabbing and inserting the microbiome into the kiddos. But C-sections deprive the kid coming through the vaginal canal and getting that bacterial information from their mom. And look, bacteria work under environment too, right? So the bacteria that we have on us is impacted by our diet, our exercise, our stress. And so that bacteria impacts our hormonal levels. And so, this is important stuff. And then we have antibiotics. I had a kiddo, he came in, he's one and a half. Yeah, 1.5. He had been on 8 antibiotics by the age of 1.5. So every about 2 months or so, he was on 2-3 months. He was on an antibiotic. I mean, so they're just destroying, and this is for ear infections. They're destroying the bacteria in his gut, which is important for neurotransmitters, right? And it is important for digestion and health and all this other stuff for the immune system, because look, 80% of the immune system comes from the gut. And so literally they're just destroying his immune system, or part of his immune system, right? So look, this is all so important. Acetaminophen is acetaminophen, so it's Tylenol, depletes glutathione, which is so important for detoxification. And so, we have, they're telling moms it's okay to be on Tylenol. Look, I'm not saying that one use of Tylenol is going to be, the end of the world, but when we have moms that are, getting headaches or having pain and all this stuff, and they're, the doctor's like, well, you can take as much Tylenol as you want. That's not true. That's not true. That depletes it, and so it ultimately impacts the kiddos. And then we have breastfeeding issues, and there's all sorts of stuff going on with that. I'm not going to get into that right now. And then there's the hypersympathetic response. And so what that means is a high stress response. And we have moms and parents, dads too, who are just hyper stressed. And, I always think of this one kiddo. He was just the epitome of ADHD and neurodevelopmental stuff. And I felt so bad for this kid. They had to stop care just because their life was so chaotic. But just the truest form of ADHD I've ever seen. I think he was in third grade, and they tried medication. Nothing worked for this kid. Nothing worked. Um, his mom, his biological mother, was a drug addict and was physically and verbally abused during conception and pregnancy. Um, Mom had to give up her son at some point in time. I don't remember when she gave him up, but she had to give him up because of the drug dependency. And so his grandparents took him. So his grandparents were the one that brought him in, and he called them mom and dad. He also called his mom. So I'm not sure if he understood the difference, but I mean, his grandparents were his mom and dad, and it's just so sad. And they ended up having to stop care because the great grandfather who had dementia, so the grandmother's dad, came to live with them, and then the mom, the biological mother, had come to live with them. And this kid, you could just imagine the stress that this kid was under. It's just so much. And so, look, all of these things matter developmentally because they're different stresses, and how we're able to process our world is dependent upon what has impacted our development, what has impacted our brain development. And we know that C-sections, antibiotics, acetaminophen, all this other stuff, stress impacts our development. Okay, so what's next and where does health come from? Do you have any questions here? I'm gonna stop for a second, see if you have any questions. Amy, I don't know what name you were referring to, but you can just message me or text me afterwards. I'm happy to answer that question for you. I'm gonna give it a second. There's definitely a delay between me talking and any messages that I see. So I'll give a few more seconds because I don't want to waste your time, because this is not coming through right away. But okay, so this is the crux right here. When you have a kiddo with a developmental issue, okay? When you have a kiddo who has ADD, ADHD, OCD, autism, you have to look at development, okay? This is where we've missed it, okay? This is where we've gotten lost on the topic, okay? There is it's a linear progression that we make, okay? So we have A, B, C, D, we have step. That's how development works, okay? So primitive reflexes, that's what brings us into the world. It's involved with the birthing process. It's what allows us to feed. It's what, we grab onto our parent's finger. Primitive reflexes help us in the initial moments of life. They help us get out of the birth canal. It's like computer programming that's there to help us survive the first few months of our life, okay? Most of those primitive reflexes are gone by 6 months, and ultimately they should be all gone by 1 year, okay? One of the things I think has been completely misunderstood, okay? So when you talk to a neurologist, okay, what they'll say is if we see a primitive reflex later on in life, there's what we call a hard neurological sign, meaning there's some sort of brain damage. But that's not inherently true, okay? One of the most cutting edge, what is her name? Her name is Sally something. She's an OT. She talks about primitive reflexes and how they can be retained into the first few years of life, sometimes even further along, right? And so you have these kiddos who come in and they have primitive reflexes. If I see a 5, 6, 7, 8, 9, 17-year-old with primitive reflexes, I ultimately know that the development of their brain has been halted, stopped. Meaning the brain kind of develops like this, like a flower. Bottom to top, back to front, internal, external, right to left. Okay? That's how brains work. Sorry, somebody just... Hello? Yeah, I'm in here. Sorry, somebody walked into our suite. And so when that's altered, it ultimately impacts everything above that. Okay, so primitive reflexes are here in the brainstem, impacts everything above that. Okay, primitive reflex, and then movement. So gross and fine motor movement. That's why anytime I hear a parent tell me, look, my kid didn't crawl, they crawled, they didn't crawl on all fours, or they crawled weird, or they scooted weird, or it wasn't a typical crawl, what we think of a crawl. I ultimately know that that's where that all started, the crawling. So we got gross and fine motor movement. Like at about 6, 7, 8 months, we should start crawling, right? And then we should start, standing on our own, and then eventually by about 12 to 13 months, we should be walking. When we have a delay in that, assuming that the kid wasn't born premature, we ultimately know that there is an alteration in the way that they were interpreting their movement, their gross and fine motor movement, which I know will impact them. The depth of impact can alter from kid to kid, but we know that altered gross and fine motor movement ultimately impacts the development of the brain. And then we go on to auditory processing, okay? So we go primitive reflex. Primitive reflexes are shut down by movement, so gross and fine motor movement. And then ultimately we have auditory and then visual, okay? And I'm not going to go too far into those either, but that's why a kid will start asking why. So they're starting to understand their world through movement, right? They fall, they understand that, all that's beautiful. We want that to all to happen, right? You understand that gravity exists and that, there's steps and all this stuff. But then they start asking the why, and then they start interpreting the world visually. And so if you have a kiddo whose system, his sensory system, sensory processing, and sensory integration has been altered during development, you'll get a 5-year-old going into preschool. And in preschool, there's a higher visual and auditory demand on the kiddo. But imagine they haven't developed the way that they should. That's going to be too much stimulus. So usually we see a couple different things. Either the child will pull in, right? There's kids playing, I can't pay attention, too much noise from the teacher talking, so they pull in. So they try to pull in and protect themselves. Or we have the opposite, right? Where they just start going with the motion, right? Like, so my eyes, too much demand to sit there and watch the teacher. So, my buddy Tom over here is moving, so I'm going to be distracted by him, right? They can't process their world efficiently and correctly because of development. And so this is what we've been missing. So in that book, Disconnected Kids, he talks about a lot of this stuff. And so, again, it's a great book. It's by Dr. Robert Melillo. Melillo. And so I think it's a great book because he gives parents, he's very good at writing, and he gives parents a good broad understanding without getting too in depth. And so it's a good book. But ultimately, our brain develops through reception, processing, and integration. Okay? And we're seeing hiccups definitely in the integration. Motor integration, auditory integration, and visual integration. And until that integration is improved, until you can help that kiddo improve the sensory integration, the information coming from the internal and external, and help their brain understand it, they're always going to have issues. And so this is the crux. But we get input from our spine. That's what I do as a chiropractor, right? So the muscles, the tissue, there's a bunch of receptors that tell our brain where we are in space, help us move through space efficiently. And there's this book, and it talks about how movement and proper efficient movement is the key for higher brain function. It's pretty cool. And basically what it, kind of the summation of it all is we need good movement. And without good movement, we run the risk of, falling prey to injury and all this other stuff. But what he ultimately says is that the higher parts of our brain, the parts of our brain involved with executive function, so academics, understanding that if I punch Tommy in the face, I'm going to get in trouble, right? And understanding social cues, right? Like, all right, Tommy's mad at me now for punching him in the face. All of that is from this part of the brain, the prefrontal cortex. But if we don't move well, which is involved with the cerebellum and some of the other parts of the midbrain, then ultimately what happens is this prefrontal cortex has to watch things below it. And so we take from the prefrontal cortex to monitor the middle and the back or the hindbrain. And so we lose executive function in order to navigate our environment. Because ultimately, we are the most advanced moving creatures, right? Because we can do basically all sorts of stuff, right? Walking two legs is a very high functioning way of movement. We can swim, climb trees, all this stuff. And so our brains, because we can do all this stuff, have to navigate environments. Like, look, there's somebody chasing me, right? Or there's a bear chasing me, a tiger chasing me. I need to figure out, do I need to run this way? And so that higher parts of our brain, they're involved with all of that. If we have poor movement and sensory integration, they take from this, start monitoring this, and ultimately that is where we see a breakdown in so many of these kids. Again, not all kids, because some kids actually do have some kids are very coordinated, right? So we'll have the kiddo who's a football star, right? Super coordinated, can catch anything. So he got through that. He got through the gross and fine motor movement, but for whatever reason, thoughts or some sort of trauma, right? Ultimately had an issue with auditory processing or visual processing, and thus he may be terrible in school academics. And so, again, that was just to kind of give you an idea that, look, a lot of these kids have gross and fine motor movement integration issues, and they say anywhere of I've seen stats of 50 to about 80% of kids with ADHD and autism have motor skill issues. Okay, so ultimately, in the end, think about it this way: if you're going to go pick this up, you have to plan picking this up, right? Actually, let's pick this up. This here, right here. This has some weight to it, and I have to tip it a certain way. So motor planning is how we navigate our environment. And if we can't do that properly, it ultimately leads to other developmental issues and sensory integration issues. All right, so that ultimately is called disafferentation. All right, Amy, sorry, I'm reading your question. Sorry to cut in, but I would like to clarify. Executive function development is related to prefrontal cortex, frontal lobe is related to executive function. Again, there are parts of the brain that are feeding into the prefrontal cortex, and so there can be basal ganglia is a big one. There are other parts of the brain, but the prefrontal cortex and the frontal cortex is involved with executive function. That's right up here. All right, so disafferentation is basically altered, impaired, improper sensory information to the brain. Okay, so the nice thing about this is we can change this stuff, right? So I mentioned the 40-year-old women that were doing yoga and Tai Chi or whatever, and how they showed neuroplasticity. Neuroplasticity is the ability for the brain to adapt, change, and essentially alter course based off of information. When our brains cannot integrate sensory information properly, efficiently, correctly, then we get stuck essentially in a rut, and there's limited or minimal plasticity. But the beautiful thing is we know now that the brain can change. And so if we understand that these kiddos have primitive reflexes and they have gross motor issues, and we start changing that stuff, so we start changing the sensory information to the brain, we can ultimately change how the brain communicates and functions within itself. All right. So a couple testimonies here real quick. This dude is awesome, super cool guy. Came in primarily because of ADHD and emotional dysregulation, but also felt like a zombie on medications. But one of the things I want to highlight here is one of the easiest ways to tell if a brain is functioning well very quickly is just looking at posture. So you can see this little guy's head is tilted to the left a degree. So I mean, he's tilted like this. That might be right on your screen, but he's tilted off to the left. So think about this. So we have our inner ears called our vestibular system. That tells our brain where we are in space, along with our eyes. So his eyes and ears think this is correct. And then if you look down in the bottom picture, his head is anterior forward 1.9 degrees. So his head weighs, these numbers aren't always accurate because it just takes your weight and then kind of divides it, but or guesstimates your head weight. But his head weighed about 6 pounds. That's probably accurate for his age and everything. But effectively, it weighs 17 pounds. Again, somebody was confused by this one time. His head weighs 5.9 or 6 pounds, right? But because his head's gone forward 1.9 issues, it's like his head weighs 17 pounds. So eventually, as your head goes forward and the body has to hold it up, it's more work essentially for the body. And so this, with the head tilt, his eyes are seeing the world from a different world. His inner ear, his vestibular system is off. So this kid had poor balancing skills, which again, poor balancing equals poor attention, because if your brain has to keep you upright and functioning in space to keep you alive, right? So that you don't trip and fall off a cliff, or so that you can escape a bear or tiger or whatever, because your brain's ultimate thing is survival, right? If it has to monitor your movements, it's stealing from here to monitor this. So you can always kind of look at posture. But this little guy was awesome. He had a lot of attention issues in school, but when I was seeing him, better body awareness, less emotional dysregulation, better attention, and so it's kind of cool to see all this stuff. Lots of anxiety. But again, anxiety. Let me explain something here, because I don't think this is well talked about. Anxiety. A lot of times, especially with kiddos, is the inability to predict the next thing. Okay, so think about that. If it's if you're in a dark room that you're not familiar with, you can become very anxious very quickly because you don't know your surroundings and how to interpret that all and what's going on there, right? And so when you have light on and you can see things, you can navigate that well. Kiddos with anxiety, a lot of times, because they have poor body awareness, because their prefrontal cortex is not working well, and they can't interpret, facial and verbal cues well, they live in a world that isn't clear for them. And so they navigate it much more in a trepidatious, right? So they struggle to understand their environment. And it's key to help these kids. We need to help them navigate by helping them predict. So one of the things I tell the parents, this kiddo is, I think, 11. One of the things I tell parents is, look, if your kid struggles with anxiety, one of the things that you want to do is you want to help them see what's going on next. So, holidays are a big time for kiddos. They get stressed out, maybe they don't remember grandma's house, or, maybe grandma moved, or whatever else, right? And so you're going to grandma's house, right? So what I tell parents with kids with anxiety is like tell them what's going on. Maybe show them a picture, right, of the house that you're going to, and maybe say, hey, this is your uncle Brian, right? You haven't seen Uncle Brian in a long time, but this is what he looks like. Okay, so he's going to be at the party. This is your dad's brother, okay? And so what you're doing is you're giving them some frame of reference, right? You're helping them. They can't see the future. They're struggling to see the future. So what you're doing is you're giving them pictures. You're giving them a framework for what it's like, what people they're going to see. Like, look, Uncle Brian is your friend, this is your brother's, your dad's brother, look, or whatever you got to say, or this is the room that we're going to celebrate and eat in, and, we're going to have turkey at 2:00 in the afternoon, and pumpkin pie right afterwards. So what you're doing is you're painting a picture for them to help them understand and navigate their world. Because a lot of times these kiddos, because of poor prefrontal cortex integration, sensory integration, because they struggle to interpret the internal and external world, they struggle with prediction, and prediction causes anxiety issues. All right, this is a cool kid. I liked him. He was just fun to work with. He came in at 17. Unfortunately, if I could have gotten him a little bit younger, I think I could have prevented. He had to have his tonsils removed. when he started care, he had missed so many days of school because of sinus infections and all that other stuff that he just couldn't miss another day. So his mom just decided to have the surgery to prevent more infections. But when you see this kid, the kid, part of his issue was he couldn't sleep. He did not sleep well because of his airway. He was a mouth breather, so he had a lot of infections, poor posture. I mean, look at it. I mean, his head goes off to the right 2 degrees. So his brain and body connection was very poor, just like you saw with the kiddo above. This kid struggled to pay attention in school. Again, part of it was sleep. But he had his tonsils removed. Still was having issues though. Okay, just not the infections, but still having issues. And it was funny because I would adjust him, and his mom was like, he was out. This kid loved to play video games too, so he always wanted to play video games right during the evening, but he would get adjusted and he would just zonk out. He could not, like, his body would just kind of like relax and shut down, and so he wanted to stop coming because he would just, his body would get so relaxed he'd just pass out. Like, his mom was like, we'd get in the car, and within a minute or two he was just out, and he would go to bed right afterwards. But ultimately it helped because he was able to start paying attention in class and all that other stuff, and so he was a fun kid to work with. But look, he was a big guy. His head, 17 pounds is a little high. Average head weighs around 12, 13 pounds. You know, sometimes it'll weigh a little bit more for other reasons, but his head was for 2 inches. And so ultimately his effective head weight was 53.8 pounds. This kid just talk about, I mean, imagine trying to hold up almost 54 pounds all day long. The efficiency, the tone, it was just so much work for his brain and body to stay there. And ultimately what you see with a lot of these kids is they have poor muscle tone, right? So you'll see the posture break down. And also the prefrontal cortex is involved with inhibiting, so stopping flexion. So you'll see babies and they're curled up a lot when they're born, right? They're in what's called flexion. And that's because the higher parts of the brain have not developed. Well, once you start seeing these kids break down, you'll see them go into flexion. So you get these kids with rounded shoulders and head forward. This ultimately is the breakdown of brain function and the inability of the frontal cortex to suppress the flexion. And so you can tell from these kids' posture many times, generically speaking again, that their brains are not functioning well because the cortex cannot even do what it's supposed to do. All right, this is, she just started care not too long, in February, right before all this started. Mom came in. Her friend up in Wisconsin had good results with her kiddo and sensory issues, so she found me. And we ultimately wanted to work on sensory issues. Kind of the big thing for mom was emotional dysregulation. Okay, so, but also some, mom was kind of on the edge of, I was going to try this dietary stuff, and I said, don't try it yet. Look, we got to get the brain-body connection working better, and then we can start working on that. So this little one, I think one of the things that mom was most excited about, so we have a primitive reflex. It's called the galant reflex, okay? And the galant reflex is involved with attention, but also bedwetting. And so I said, okay, she has it. And there was some research a while ago that said that it can take up, this little one, I think she's 5 years old. And so bedwetting, okay, galant reflex. So she had it, so it started going away. And mom was like, oh my gosh, I don't have to change the sheets every night. So pretty cool. I mean, she's 5. My 2.5-year-old is, she doesn't wet the bed anymore at night. Not that that's the perfect age or anything. I'm just saying because I have a 4-year-old who still, we still put a diaper on because he still, occasionally has a wet diaper. But, at 5 years old, completely potty trained, all that stuff, getting ready for school soon, right? Had bedwetting issues still every night. And so it was cool just to see how when that primitive reflex turned off, then the bedwetting stopped. It says bedwetting improved. She has not wet the bed, I don't know. It's July 13th, whatever, July, whatever. At least since I think May, and I know May for sure, but it may be longer than that. Her clumsiness has improved. The one thing that we're working on right now is emotional regulation so much better. She's trying new foods. Mom was like, she used to like just nibble at food, so it'd take her like an hour to eat food. Now she's taking whole bites, so she's eating quicker, more efficiently. She's not falling over all the time. Better weight. The one thing we're working on now is attention. So we're trying to. She still has a primitive reflex involved with attention issues. So we're working on that right now. But just really cool story. I love working with this little girl. But you can just see her posture is so off. Like look, her head goes to the left, right? Yeah, head goes to the left, but her feet go to the right. And I mean, she's what, 5? Yeah, 5. Her head is tilted 9.6 degrees. So that means when her head tilts, your eyes actually have to turn. When your head tilts, your eyes have to turn to get you back on horizon. And then your inner ear has to start compensating. So this little one, like her pelvis was shifted, her shoulders were tipped, her head was tilted to the left, and her feet were uneven. It's just, you can see the motor movement, everything is just broken down. So, all right, I'm gonna skip over this slide. I don't even know what time it is anymore. I've been talking, I don't know what time it is. I'm going to try to kind of get through the rest of this, but the autonomic nervous system. So this is the part of the nervous system that controls all the things we don't think about. This is our fight or flight response, okay? So this is what allows us to digest. This is what allows us to, put blood to the muscles so we can run away. This controls pupillary dilation. This controls, hormonal levels, cortisol levels. This is a big system. Kiddos who cannot interpret their world well, right? So think anxiety, all of those stuff, typically have an autonomic nervous system that does not function well. So they're stuck typically in the sympathetic or the fight or flight response. So the world is stressful to them. What do you think this ultimately impacts? Digestion. Ultimately impacts, that's the big one. Let's just go there. Let's hit this point here. Because when you have a fight or flight system that is chronically on, especially with kiddos, so that means the brain is not able to turn that system down or ramp it down, you get leaky gut. So you get gaps in between the cells that in the gut system, right? So what do you think that leads to? It leads to infections. That leads to things getting through, proteins getting through, and allergies developing. Now, I'm not saying, please don't misinterpret this, that 100% of the kiddos who have, sympathetic and leaky gut, and if you correct that, all their allergies will go away. I'm not saying that. Please do not misinterpret that. But when you see things like egg allergies and other allergies in kiddos, and you know that their autonomic nervous system does not function well, right? And that the gapping in their stomach lining may be opening and allowing proteins in and causing an immune response that's not normal, closing those gaps at the very least may help that child. And so most of these kids, a vast majority, like 85% of kids with autism have digestive issues, okay? I don't know what the number is for ADHD, but it's still high. So we have these kids that are stuck in fight or flight, their bodies can't ramp down, they have poor sleep. When you're in sympathetic drive here, meaning fight or flight drive, what is your brain prepping to do? Fight or run? Do you think if you're in fight or flight that your brain is going to sit down, absorb material? Do you think you're going to be able to sit in class? Absolutely not. That's not how it works. The brain is not designed to sit in class and understand the instructions from your teacher when it's in fight or flight. Also, when we get sympathetic, dominance or it's overrun, your immune system gets shot over time. This happens to parents all the time. This is why everybody gets run down, and part of the reason we all get run down during the holiday season, right? Why do we see a spike in, colds and flus and all that jazz during certain parts of the season, right? It's stress. Part of it is stress. And so if we have a stressed out system, a body that's stuck in fight or flight, that cannot ramp that system down, go into parasympathetic response, meaning rest, relaxation, building, healing, then ultimately these kids are just prime targets for the cold and flu bugs, right? They're prime for digestive issues and all sorts of other things. And so, this is an important system. We monitor that. We have what's called HRV. So we do HRV on these kiddos, and it starts for heart rate variability. And ultimately, when our sympathetic response is high, we don't see any change in the heart rate variability. It's very stagnant. And so when we're in a parasympathetic response, what should happen is our lung field, which is where our heart is in this chest cavity, right? When we breathe in and exhale, there's a difference in pressure, right? So do you think that the heart, which is an organ impacted by that pressure system, do you think it should, change according to that pressure system? Absolutely. If the heart has to push harder against the system, that's harder work, right? So it's less efficient. So ultimately what HRV is doing is looking at, is the heart rate changing over time with breaths in and out? And it should. If it doesn't, that means the heart gets worked harder. And guess what we see in adults? A heart that has to work harder, blood pressure. All right. So these are some of the symptoms that you may see with too high or too low of an autonomic nervous system. So look, most of your kiddos with ADHD, autism, all that other stuff, most of them come in and they have irritability, emotional focus issues, digestive issues, sleep issues, excessive sweating, okay? That also that's some other stuff that maybe my wife could talk about if you all are interested. That excessive sweating means you're not doing a lot of things right, but that can be or high sympathetic system, neurodevelopmental disorders, anxiety, right? But then you can also get the other people who are low parasympathetic. So their body doesn't ever go into good rest. Doesn't mean their sympathetic system is too high, but it means their parasympathetic, the system that's supposed to kick on, rest, relax, do the healing, all that stuff, doesn't kick on all the way. And so we see, depression, mood issues, chronic fatigue, fibromyalgia, hormonal issues, thyroid problems, adrenal fatigue, brain fog. I mean, this sounds like all of our adults right now, right? I mean, what are we seeing? We're seeing spikes in chronic fatigue, fibromyalgia, right? Hormonal issues, adrenal fatigue, brain fog. I hear this all the time. Autoimmune diseases are up. And so, look, all of this is, can be tied back to this. Again, this is not always this simple, okay? So please don't, it has to be this one thing, but these are real common things, real commonalities with imbalanced nervous system. Yeah, so they don't have to have an inherent, well, Regina, we can talk a little bit about that. So look, you can have some of these symptoms, you don't have to have all these symptoms, right? You can have high sympathetic, and they can have ADHD issues, but no current GI issues, right? Because in the end, it depends upon where they got impacted developmentally and the amount of, stress. So there are variations to this. Again, if you have a specific question, happy to answer it. You don't have to have all of these. If you have high sympathetic, doesn't mean you have all these. I get high sympathetic all the time, and they have focus issues and anxiety. But the mom's like, yeah, they sleep 13 hours a day and they'll eat anything. It doesn't. So you can have portions of these. It depends on where they're at developmentally, what's been impacted developmentally, and then ultimately, environmental stresses that may have some impact on that too. So not every kid is the same. So these are just commonalities among kiddos. All right, well, that's just a cute picture. The second from the far right, the little girl in the pink and the kid behind her hugging her. Those are my two kiddos. This is just a fun day at the practice. All right, so what's next? It can take a village, absolutely. So we have to realize that, a lot of things can come together here for our kiddos. And so one of the things that I, try to pride myself on is, giving the best care possible, but also realizing that, look, I may just be a stepping stone in their ultimate achievable and what they need. So, it's some people come see me, and then I will send them on to what's called like a neuro-ophthalmologist. There's one up in Frisco, Plano, I think Plano, that we really like. And what they do is they work with eye coordination. I do a little bit with that. So I do have some of my kiddos with ADHD. I have an application on an iPad, and I'll have them do things like anti-saccades and other stuff, which helps with brain coordination with movement and all sorts of other stuff. And so in impulsivity. But look, some kids have really bad eye sensory integration. And so I'll get their motor system working, I'll get their spinal, system working and all that stuff working. But then remember, there's auditory and visual. And so, sometimes they need additional stuff. So I take pride in the fact that I don't try to be everything to everybody, but at the same time realizing that in not being, I'll use the word arrogant, that I am the answer, I'm the whole thing for everybody, right? Because I am very good at what I do, but I'm not everything for everybody. All right. So where's the disconnect? I'm telling you right now, the disconnect is we have not looked at our kiddos from a developmental trajectory impact. And so again, I have parents that'll come in and they'll say, look, I've seen this, and their pediatrician, I'm not pointing fingers at pediatricians, will say, look, I see that all the time, they'll grow out of it. And so we've missed this brain development, and we've missed this autonomic, and it's being skipped because, look, I've talked to pediatricians. They're like, look, kids don't have primitive reflexes after year 1, so I don't check them. But, what their medical doctors are looking for is they're looking for pathology, right? They're not looking for what we call like soft neurological signs. They're not looking for function. They're looking for disease. And so, they're missing some of this. They're not spotting this all the time right away. And so it's getting a little bit better, but we're missing this disconnect of we need to spot where these kids are developmentally. And secondly, parents, we need to understand deflections in our kids. And what I mean by deflections is when our kid pulls in or gets super hyper, they're deflecting from demand, visual, auditory, physical demand. And so you have behavior. Okay, so I'll give you an example. 15-year-old and mom was like, my daughter never listens to me. She doesn't care what I say. She's always disobeying. And this poor little girl, 15-year-old, had auditory processing issues, right? So 15 years old, mom would give her verbal commands. I'm just giving examples. I don't know exactly what the mom said, but go upstairs, start your homework, right? At 6:15, it's going to be dinner. So make sure you change before you come down, and I'll see you around 6:15 for dinner. Okay, so 3 commands. If you have intact, auditory processing, you hear it, and then you integrate it, and then you put it into your working memory. Okay, so I gotta go upstairs, start my homework, 6:15. Gotta make sure I change, come downstairs. Okay, this poor girl could not take that information and put it into working memory because her auditory processing and integration system was not functional because of motor movement issues. But ultimately, once we figured that out, I said, mom was instructed to write out the commands. So go upstairs, change your clothes, come down at, set a timer for 6:15, come down for dinner. Okay. And this girl, it changed the relationship between the mom and the daughter because the daughter wasn't being defiant. That's what they diagnosed her with, defiant disorder. She wasn't intentionally being defiant. She could not take that information and process it. So she also struggled in class, right? You're sitting in front of an instructor and they're like, all right, boom, 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 boom. Well, unless it's written out for her, unless they write it up, write it or give it to her written, she struggles academically. And so it's so important to look at the child as a whole and understand where they are developmentally. Otherwise, their behavior can look defiant, disobedient. It can look all sorts of other things. They can look like bad kids, right? They can look like they're doing this intentionally without any intention. So, all right. I'm going to kind of peruse through this really quickly because I don't even know. Again, it's got to be getting late. Vertebral subluxation. So Basically, what I look at from a spine aspect is how is the spine functioning in space. We call that vertebral subluxation. That is related to muscle tone, so brain control, and alignment, and all that other stuff. So this stuff plays an important role. When I can help a kid who's stuck like this and get more straight from adjustments, take out the twists and the turns, I'm helping them be more efficient from a gross and fine motor skill set, which ultimately, ideally, works into better balance, which ultimately leads into better auditory processing and ultimately better visual processing. Ultimately, I see a lot of help with visual processing, because if you have a kid like here and they're processing the world from this tilt, but you can get them back on horizon, then they start interpreting the world differently and better. It also makes it easier for the eye motor control. All right, this is a fun one. She's a dancer. She's a very skilled dancer. She's been a lot of fun to work with, sensory issues. One of the main things here, talking about other providers, right? So one of the things that my wife and I are keen at looking at, my wife looks at a lot too, more in infants, but is tethered oral tissue, so also called TOTS. This girl was awesome. She's so cool. Loved working with her, but she had a tongue tie, which means that the tongue was tethered literally to the bottom of her mouth. So we had that tissue on the bottom of her mouth. She couldn't stick her tongue out. That's all the father, she could stick her tongue out. So she would choke a lot on food, right? Big sensory thing, right? Alters speech. You can have delayed speech, alters sensory information coming to you. She had a tough time standing up straight, because literally, most people don't know this, but the fascia from your tongue actually attaches to the bottom of your mouth, and then actually, if you follow it all the way through, it goes all the way to the bottom of your feet. So crazy story. She gets this clip. She can start eating better, articulation's better, some improvements in sensory issues, but her feet go flat. They go from high arch to flat. So it's just crazy. So when you look at the child, though, as a whole, I don't see a diagnosis. I see the kid as a functioning being, as a physiological, biological system that's trying to work in harmony and function. When you do different things like this, you can dramatically change a kid's life. So now she's able to stand upright more. She's more efficient. She's like, I don't get as tired dancing. She's a phenomenal dancer, sponsored dancer. It's just kind of cool. She had commonly called knee knock, so her knees would touch, but her feet would come out, like so. Knees would touch, but her feet would be separated. She couldn't put her feet together. So after working with her, we've been able to get her knees and her ankles to touch. Just really cool stuff to see and help her with. And so she's just functioning better as a dancer. She always had, feet, knee issues, hip issues, and so outside of just the sensory stuff. So look, it's not one thing. Sometimes it's multiple things. Sometimes you have to look at how the tissue, how it's tethered, and she's just fun to work with. All right, so structure does affect function, right? And so when we have an altered structure, which ultimately we know has to do with the brain and tone, okay? When we have a structure that's imbalanced and creating stress and impacting the way we move and function in space, it causes issues. And so when the brain, the part of the brain, the frontal cortex that's monitoring the autonomic nervous system, that's monitoring our immune system, that's monitoring our gut stuff, it's really kind of the king of the whole system, right? That is controlling it all, ultimately, in the end, is being diverted to movement and function and tone and just trying to survive, then we see all sorts of autonomic imbalance. And then autonomic imbalance leads to gut issues. And the autonomic issue leads to blood flow to the brain and inflammation and altered immune system, high or low. And so we see this all. And so we need to start looking at it this way, creating better structures so we have better function ultimately. All right, I'm going to kind of go through these pretty quickly here. Thank you so much for sticking with me. Basically, a neck or chiropractic adjustment alters sensory motor integration. This is a really cool study. So actually what they showed was that when they adjusted the neck of the individual, they actually saw changes, neuroplasticity changes to the prefrontal cortex. So they actually showed improvement of sensory input to the prefrontal cortex. Dr. Heidi Habik is her name. She's hopefully coming out with another study on ADHD. She also did a really cool study with improvement in reading. It's pretty cool. So, all right, cool. Because ultimately, the upper neck impacts vision and coordination of the eyes, and so it's kind of cool just to see that they were able to improve some reading skills because of better eye coordination. Okay, this was one. This study, again, a chiropractic adjustment and the impact on the parasympathetic response. So we saw better improvement of parasympathetic response in individuals who received chiropractic neck adjustments. I have a friend, one of my friends, she did a little case study over a year. She had 3 patients, and they were adult patients, and she showed, I think, a 300% improvement in autonomic and function. That's pretty sweet. All right, decreased heart rate and increased total power from the HRV. Okay, so again, when our structure is altered and it's impacting prefrontal cortex, higher brain functions, it ultimately impacts the autonomic nervous system. So if we can create better structure and function, we ultimately impact the higher parts of the brain and thus impact the autonomic nervous system. All right. Yeah, so if you're talking about my friend, yeah, okay, so adults and kids are not different. They are different, but they're not different. Kids are just smaller brains of adult brains, okay? So ultimately, in the end, aside from development, the same input impacts kids too, right? So you can still impact kids through chiropractic adjustments. They're just miniature brains of adult brains. So she is working on an ADHD study with kiddos, but it's just cool to see. Yeah, there's no outside of development, right? So you'd have to be talking about like 2 or 3 year olds. Maybe if we're talking about kids, 2 or 3 year olds, you could make an argument. But as a whole, a kid's brain is the same as an adult brain. It functions in the same manner. May not be as efficient in some areas, but as a whole, by the age of 3, because we're born in a sympathetic state, so we are sympathetic in the beginning. But as our higher brain kicks on 1, 2, that starts suppressing, and so by the age of 2, 3, our brain should have control over our autonomic nervous system. Okay, and so really at that point in time, it does not make any significant difference. That's my little sweetie there. I just like that picture of her because I think she's cute. And this was just something that a mom wrote that was super nice. Okay, this is a friend of mine. This is one of my mentors, Dr. Steve Tullius. This is his kiddo, okay? And this kiddo, have any of you heard of PANDAS or PANS? He's one of these cases. So this is what that did to his body, his brain. You can see the stress that it did on the brain, and you can look at the different heights of his shoulder blades, the scapula. His pelvis is all distorted. Look at the ears and head are tilted. I mean, look at this. These are signs of an altered brain function. And so ultimately, I skipped ahead and didn't mean to do that. Ultimately, we saw with that kid is the breakdown of the structure and function because of what that infection did to him. Here's a cool little kiddo, Brett. Seizures. No recorded seizures. How cool is that? And now 95% seizure free. So seizures. This is a whole big thing. But basically, sensory input and processing of that information can lead to seizures, right? And so it's just cool to see. I mean, look at the posture, look at the tone there, and then look at the smiles and just the difference in this kid's expression, right? And just, it's so cool that if you can create and change the neuroplasticity, you can take kiddos and alter their life completely. All right. This is autonomic imbalance, okay? So actually the spine skeleton here, that's one of the studies that we do, but you can look at autonomic imbalance based off of temperature, because autonomic nervous system regulates blood flow, hence heat. And so you can see spikes in different areas where there's autonomic dysfunction. That doesn't have to lead to pathological dysfunction. It just means physiological dysfunction. So two different things, but you can see now deviations from normal values will allow suspicion of neurological pathology to be quantitated. So meaning that maybe over time, that this, if stuck in this state, over time that we may see some pathological issues. But again, remember when we see hypersympathetic or hyper or low parasympathetic, we see autoimmune, all this other stuff. So the way that we measure it in this office is through paraspinal temperature. So we do the HRV, we do the paraspinal temperature, and we're looking at how is that autonomic nervous system functioning. The neck and low back are parasympathetic, and the mid back, or where the rib cage is sympathetic tone. So that's where that comes from. All right, here's just an example of one, so you can just see that the upper neck. So usually when I see a kiddo like this, or even an adult, doesn't really matter, but a kiddo like this, you're seeing the parasympathetic response from the upper neck struggling to kick on or counter the sympathetic dominance that we're seeing. So this is a kiddo who's struggling to typically kick in that parasympathetic response. This kiddo, or this person right here, it's all one-sided, and we see some, so the grading scale is white's ideal, okay, not abnormal difference, or within normal limits. One is mild, blue is moderate, red severe. So both of those studies. And what you're seeing here is a one-sided dominance. So we don't really even see anything on the left side, okay? So the autonomic nervous system is on the right and left side. We're seeing a dominant side. Typically that's with a heavy brain imbalance, right and left side. That's what Dr. Melillo talks a lot about in his disconnected kids, but it doesn't have to be for every kid. But we see a heavy dominance on one side, and then we see different areas, T4, T5, we're talking heart, T9, we're talking kidneys, L2, we're talking digestive system. So this kid may have some issues in some of those areas. Doesn't have to. And just remember, sometimes issues are just an efficiency thing too, right? Like, I'll have some parents come in and they'll say, my kid doesn't have digestive issues. Okay, cool. How often do they poop? They poop every 2.5 days. Okay, there's a digestive issues. Yes, they poop, but they're not pooping every 24 hours. And so sometimes it comes across as a slow or not slow. It doesn't come out as a hard manifestation of an issue, right? It can be like, hey, you know what? My kid poops, but he poops every 2 days. Is that okay? That's common, right? That's what my pediatrician told me. Look, your digestive system should be flushing that stuff out every day, right? And so you can not only, 2 days every once in a while from stress. Okay, I get that. That can happen, right? But if you're seeing this, all the time on the regular, no very minimal deviation from this, then you're talking about a digestive system that can become toxic, and you can get all sorts of bacterial overgrowth and other stuff. It's just, all I'm saying is, look, sometimes the symptoms are right there staring us in the face, and so it's so important to look at how the physiology is functioning. All right. Okay. This they just showed. This is in males again. No significant difference between adults and kiddos after a certain age. So I don't, that's why we're not gonna. We won't touch on that again. Sensory motor integration. It changes the brain activity by up to 20%. So cool, because what that's basically stating is that adjusting the spine changes brain function. That's what she says right there. But it impacts the prefrontal cortex, right? And so when you're adjusting the spine, when you're changing the structure, you're ultimately impacting the input and the sensory information to the brain, which ultimately helps the brain function more efficiently by upwards of 20%. So really cool stuff. All right, there's conflicting results in this one, but when they adjusted the upper neck, so the upper part of the neck, right? What they showed, I've seen a couple different studies. I've seen more for than against, but what they showed is actual change in CSF fluid. So CSF fluid is cerebral spinal fluid. So that's what nourishes our brain, helps clear out toxins and stuff like that. And so they at night they did a cool study recently, and they showed there's like big waves of CSF fluid that come and clear out our brain. Big waves. Okay, so they go in there and they kind of flush it out. We know we've chiropractic talked about this for at least 100 years or so, about how the cranium and the sacrum play an integral role in the movement of that CSF fluid. So it's a pumping motion that happens gradually. There's a few pumps throughout a minute, right? So it's not like a constant, like every second there's a wave, but there's these pumps, right? And so we know that if the pelvis is stuck or that their skull is not functioning the way it should, that ultimately impacts the CSF fluid. They've been talking about that for forever. So on top of chiropractic, I also include craniosacral care, because not only is the spine important, and the sacrum is part of the spine, but the cranium and how the cranium is pushing and helping the brain pump the CSF fluid. One of the coolest things that I commonly see is better, once you start working on like the sinuses and stuff, lots of kiddos have better allergy, seasonal allergy complaints. So, all right, those are my two little keys. I didn't have a picture of this girl. This girl was awesome. She was a 7-year-old on 2 medications when she started care, doing OTPT, needed glasses. I'll explain that in just a second. Extreme emotional outbursts and trouble at home. So she did care, got off of both medications. OT and PT were no longer needed. They said, you crushed it. There's no longer a need for this. What was funny is at the time, her mom's like, yeah, she needed glasses, but now she doesn't need glasses. I don't get it. Well, you can imagine with the posture distorted like that, right? And your eyes are having to strain and work harder, then glasses may come into effect, right? Don't get me wrong. I'm not saying that everybody needs glasses, there's a lot goes into this, but it was just, hers was a structural thing. Hers was a balance in the musculoskeletal system, ultimately impacting the eyes, since her eyes were straining and fatiguing out early. And so they're like, well, she needs glasses. Well, she got glasses. She didn't like to wear them. And but then she went back, and then they're like, well, now her vision's fine. It's 2020. She outgrew the glasses. Doesn't make any sense, but she outgrew the glasses. And so it's just kind of a funny thing. Like, mom's like, I don't get it. And so it was awesome. She didn't need to do PT, off medication, OT, emotional outbursts. That little 5-year-old I was talking about with the bedwetting, if you've been watching this far, they did OT for a year and a half. I have nothing against OTs and PTs, not in the slightest. Again, I talked about how I work with other professionals, and so I do that. I do work with them, but it ultimately depends upon the development and the integration of the system. And if you don't look at that, if you're not addressing that, you cannot force a brain to do something if it does not have proper integration. And so what we'll see, right, is you'll have kiddos with poor sensory integration, and then they're doing OT or PT, and it's a sensory integration issue and not an OT issue, okay? But I do have some kids that after they finish care, they'll finish up OT and do amazing stuff. So really cool. All right. Yeah, what causes vertebral subluxation? So what are we talking about? Stress. There's 3 forms of stress: chemical, emotional, and mental. And it's important to address all, right? I will address the physical. And then my wife, she does a lot of nutritional. She does the chemical. But as parents, too, it's so important to understand our kiddos and why they deflect and why they retract or why they don't pay attention. And when you do that, and you can hit from all 3 sides, the physical, chemical, emotional, or mental, you can really see leaps and changes. And so that little girl that I mentioned, the one that didn't need the medications anymore, one of the issues that we had was that the dad was just a mean dude. So there's still a lot of mental stress in that environment. He was not supportive. He was angry. I only met him a handful of times. Was never nice to me. And so, any residual things that she had going on, physically and chemically, she was not on medication. Mom gave her a good diet. Physically, she was doing great, but the mental stress from the father, I know, impacted her in some way, shape, or form. All right. How common is it? So 1,000 infants were checked in the first month of life, and 80% were found to have a vertebral subluxation. So that's a misalignment or structural change in the upper neck. A German osteopath did a study, and he found 99, so anywhere from 80 to 90% of kiddos from birth. Sometimes it's from the C-section. I've had some pediatricians, don't ever take your kid to a chiropractor. Their adjustments are aggressive and blah blah. Look, a pediatric adjustment is, it's like moving a quarter across the table, right? That's the pressure intensity that you use for like infants. And I don't know if you've ever seen a C-section happen, but the way they pull those kids out, you get a sprain strain of the neck. It's just they pull them out right by their, like this, right? And so it's no wonder, and especially in America, because I think we average 38 or 39% C-section rates, but also just during natural birth. Okay, so even if whatever, everything is perfect and we don't need a C-section, everything else. My little guy, my little son, the cord was wrapped around his neck. So he, we had him at a birth center, right, with a midwife. But he sat in the birth canal. I was there. I viewed it. I saw it. He sat in that birth canal for, it seemed like forever. It was probably 20 or 30 minutes, but you could just tell that it was just pulling on him as he was trying to get out. So my wife's, contracting, and he's trying to push, and the cord's pulling on him. He had a misalignment right away. Guaranteed 100%. I adjusted him. I saw it. He was adjusted within about 2 hours of being born, and it was there. It was present. Birth is a stressful process, right? And so a lot of times it can happen at birth. All right. Yep, same study. Okay. 1,250 infants were evaluated during the first 5 days, so the first week. 90% had suffered some sort of birth trauma or strain of the neck and cranium. 10% were severe. So again, birth is just as a tough thing for mom and baby, and so it's important to we like to see these kids within a few days, of being born, because ultimately this can impact the trajectory of their development. All right, let's keep going. All right, KISS syndrome. This is the one from the German Biedermann, Dr. Biedermann in Germany, and so I got his textbook. He's a pretty cool guy, but he was talking about there's all these risk factors. He calls it KISS syndrome. KISS syndrome is literally just poor mechanical movement of the upper neck. That's just and so basically what it does is it impedes that afferentation. So if you remember that slide that said disafferentation, so it impedes input to the brain. Long labors, rapid delivery are common. C-section, extraction, vacuum, twins or triplets, prenatal positional anomalies. So sometimes they get stuck, they don't twist. My wife does, what is it called? Oh my gosh, I can't. Webster technique. So, if a baby is stuck in a position, she looks at the ligaments and tries to ease the tension in the system and allow the baby to freely move, right? And so, all these things can play an impact on the kiddo. All right, these are every drug has a side effect, right? Whether it's desired or undesired, right? That's what drugs do, they have side effects. So these are some of the side effects that have been reported from chiropractic. Improved autonomic function, improved endocrinology function, improved cardiovascular. This is all immune function. This is all autonomic stuff. Muscle strength. They did a cool study with special forces guys in the military, and they showed that. And I think they have low back pain, but so they adjusted low back pain in these military guys, and they showed that those who did not get adjustments, right, had like a decrease of anywhere from 10 to 15% in strength and endurance, and then those who did get adjusted had a 5 to 7% improvement. So, you're talking a 12-15% difference between those who were and were not adjusted. Oh, and the special forces guy, it was speed time, so that actually made the special forces guys quicker when they adjusted. Anyways, increased range of motion. No one should be rigid and stuck in a flex position, right? That's important. Respiratory, that was me in asthma. Visual acuity, My wife works with the couples trying to get pregnant, so reproductive hormones and all the stress involved with that. Okay. All right. So what does the session look like? All right. So this is the end. We're done. Our office, well, up until COVID, right? So now we're taking precautions. But up until COVID, very kid friendly. You can see that this is an old office. We just moved into this new office in May. But we have a toy area in the old office, and people being adjusted together, just all sorts of fun. We try to make this very family friendly, and ultimately we try to make this so that kids don't walk into this being fearful. We want our kids to walk in and not be stressed out by it, and so we try to make this as kid friendly as possible. Toys, things for them to do. This isn't meant to be a scary environment. This is meant to be a fun environment. So a lot of our kids come in, they'll play for a few minutes, and then we go get them adjusted. And some of the kids, will adjust in the playroom just because they don't want to, go to the table. But we try to make this as kid friendly as possible. We'll see post-COVID, when we kind of get out of all this craziness, what our new office will entail. But what we do is we do neurological tests. We look for primitive reflexes, autonomic dysfunction. There's another test that we do if they're able to stand, which is called the static EMG. So we look at the muscle tone. So how is the information going to the brain? And we look at all that, and we say, this is what we're finding. This is what we want to see improve, and this is what we need to improve in order to kind of go along for those steps. Okay. All right. So the special, we have two specials. Okay. One, you can do if you have a very specific question, you want to know more about your kid, like my kid's got this, this, and this, we have this diagnosis, yada, yada, yada. Okay, whatever you want to know. I'm offering a free 15-minute telehealth conference call. So meaning, you stay home, I stay here. You can do it in person if you want, but we're giving the people option of a telehealth conference call. And we'll sit down and you can ask me more specific questions about your kiddos, okay? Again, 15 minutes, all yours. If you're like, hey, you know what? I found out everything I need to know. I want to do an exam, see what's going on with their autonomic dysfunction, see if they have primitive reflexes. Our exam price is $197. But since you're here, it'll be $97. We ask for a $25 deposit though to hold that. But it's $97. I do the exam on them, everything I would normally do, right? And then the report of findings. So also I will give you my recommendations for them for $97. So you have until tonight to decide for the exam if you want to. So I'll honor that through tomorrow morning when I wake up. So if somebody sends me a late email tonight or a text message tonight, I'll honor that price. But that will go up to $197 tomorrow. Otherwise, if you want to just sit down and talk for 15 minutes and say, hey, you know what, this is going on. Do you think my kiddo is a good fit for you? We can go from there. But text me. I sent everybody a text message alerting them to this being a virtual conference call. So you can text me at that number, which is 972-387-4700. My email address is dallassynergychiropractic@gmail.com. Okay, so those are both ways to get a hold of me. All right, there's a few people watching. Let's see, how many treatments for visits? Okay. So Regina and Amy asked, number of treatments, all that fun stuff. You're going to hate my answer. It's a case-by-case basis. And so I'll tell you, on average, it's typically 36 visits, upwards to 60. 60 being, 60-ish being severe autism. But that's typically the number of visits that I'll see. In that, we do the adjustments, we do the craniosacral care. I'll do some additional therapies with eyes and balance and all sorts of other stuff. And that's what we do. So I think I just had a question come through. I'll tell you what. All right, Amy, since I said I would leave it up for 48 hours, I will honor the 48 hours. You're right, I did say that. So I will honor the $97 exam for 48 hours, okay? So what is today? Today is Tuesday evening. So come Thursday evening, I will, I'll take down the offer and I'll take down this video. I do not. It's not that I don't take insurance. Insurance. I am out of network with all providers, but I'm happy to provide you with what's called a detailed receipt that can be submitted to your insurance company. So that's how that works. All right. Any other questions? Any generic questions? Anything I can answer generically? Again, I'm happy to jump on a phone call with you and answer specific questions. But if you have, a generic question I can answer right now, I'm happy to do that. All right. I know there's a delay, but it is 8 o'clock, so that means we've gone for 2 hours. I'm going to end the session. Please call, email me, text me, send me a text message. Let me know if I can help you anyway. All right, we'll talk soon.